Hello. In this video I will explain how to contour the SuperShape Back Support for wheelchair users presenting with a lordosis. A lordosis is the normal curve of the lumbar spine. An excessive lordosis simply means that we may see a hollowing of the lower back, a change towards anterior pelvic tilt, and there may often be no contact or little contact with the back support surface in this region. We may use a lumbar support for comfort in the absence of a hyperlordosis to reduce pain and discomfort in sitting. With an excessive lordosis, we need to consider support in this area, not to push the person forward and exaggerate the curve, but rather to provide some reinforcing support to the upper back to optimize comfort and counteract the effect of gravity pushing down. Within any seating system, we want to ensure an optimal alignment of the pelvis, the shoulders, the head and neck, and upper and lower limbs. We aim to optimize overall function. We also aim to optimize pressure distribution along the person's back to ensure comfort. We may be able to minimize further progression with the correct reinforced support, and we can also accommodate this curve to bring the upper body into a more comfortable position. There are 3 independent pocket layers where padding can be configured to increase immersion, pressure offloading, and envelopment when required for comfort and optimum contact with the wheelchair user's unique postural shape. The pocket cell system allows contouring to adapt to virtually any spine and body shape. With increasing the number of positioning pads in the pockets in each layer, you can achieve approximately 200 millimeters or 8 inches of contouring depth. In conjunction with the additional modular Spex support options, this makes the SuperShape to be a well-considered postural option for people wishing to perhaps transition from a traditional molded system into a more compact yet supportive seating system. Every SuperShape comes with a positioning kit, including a lumbar pad and 2 stability wedges. 2 different densities of positioning pads are included with every system. The pink pads are very good for most contouring situations. However, the grey foam pads and positioning kit offer firmer support and positioning when required. Step 1. A good manual assessment of posture is required. This looks at various postural factors, including where there is contact with the back support, any areas of pain, if there is postural correction possible, and what reinforcing support is necessary. We want optimum contact between the user's back and the back support to optimize pressure distribution, support, and comfort. Step 2. Build up areas in the positioning cell pockets according to your assessment of the wheelchair user's postural needs. The firmer pads can be placed at the rear and softer pink pads in the front. These can be swapped if greater sensory feedback is required. Step 3. Adjustments to the contouring can be completed while the person remains seated. After initial configuration, you can remove the inner foam system, then place a pillow behind to remain there whilst you make adjustments, and then replace the system into the cover once changes are completed. Step 4. Ensure good contact without areas of significant or no pressure between the user and the back support cushion. If there are areas with additional contouring required, the positioning wedges can be used within the back support cover or between the cover and the shell, providing that there is good contact and Velcro fastening to prevent movement of the back support on the back support shell. Step 5. Complete the contouring chart. This is an effective method to record the actual changes in every pocket. This is a great way to track the posture of a person over time or refer to it later for any reason. Sometimes it can be quicker to do a pre-assessment setup for a lordotic posture. Take care to assess contact with the user and the back support to ensure that contouring is in the correct place for the user's postural needs. Here's a tip. To make it easier to put the pads into the pockets, It is easier if you place the pads over the pocket and pull the material up and over the pads. Pads can be folded over or rolled for more direct support. The front foam layer will then flow over the contouring to ensure a smooth and comfortable interface. Pad sizes are designed to correspond to the SuperShape size selection. There will be different size pads and pockets for different back support sizes. Glide gloves, or anti-shear gloves, are effective to reduce shear when assessing posture with the wheelchair user seated against the back support system. Ensure clothing is pulled down and not gathered behind the user when assessing final support and positioning on the wheelchair back support. With practice, this can be completed very quickly during assessments and seating provision appointments. Have a look at our other videos for cover care and maintenance and contouring chart completion. The SuperShape allows for a back support solution that can respond quickly and easily to complex postural asymmetry and changing postural needs. Thanks for watching.